Big, beautiful bill. How beautiful art thou? Do I love it? No. Why can't they just leave us alone? Every time I try to stay off of YouTube, something bring me back. The big beautiful bill. All I heard when because I don't have time, nurses don't have time to read all that bill, but I read it, some parts, and I listened to a lot of YouTuber talking about it, go over it. And the only thing that stuck out, because my kids say I don't listen, I listen, but they seem to say I don't listen. I absorb stuff after the fact. All I heard was nursing home staffing going to be cut because of Medicaid, Medicare. It's a problem. And you may say, oh, it's the nursing home. Old people. I don't like nursing home. I don't want to work at the nursing home. It affects you nurses at the hospital too. Nursing home patient comes to the hospital. Adults come to the hospital who may not have any insurance. If you don't have insurance, by the way, you don't really get in. And I'm talking about up north, they try to find you a kind of relief to help pay the bill or to help keep you at the hospital in some severe case. I don't know if they still do it up north, but when I was there, they do it. I don't know. I cannot say that in the South they do it or they turn you away. A lot of hospitals are hurting. They were hurting already. A lot of people think, being a nurse, that is peachy cream and everything. But short staffing was already in place for many years. When I first got here into nursing, they said, oh, a lot of people leaving nursing. Nurses can't leave. Older nurses are still working, believe it or not. So this cut that affect nursing home, and it was done, I felt, strategically. You don't want to say it's going to affect the healthcare system or it's going to affect the hospital. It's affecting the nursing home, which triggers into the hospital. How I felt about it, I felt disappointed. I felt that every policy, everything is always trickle down and affect the nurses. I actually thought that nursing in 2025 would be a little better. We would see better opportunities. We would see hospital giving us more staffing to do effective work, because once you have short staff, I was in a situation, I went to a facility. I'm a travel nurse. So I went to a facility. I won't say the state or anything or the hospital. I don't want to be liable. They used to 16 patients for one nurse. 10 patient, work in another place. 10 patient for one nurse. And I know you may think that's easy to do, Imagine you sick and you on the call light, and I can't get to you. And then by the time I get to you, you're frustrated. You want to see Blackie go home. But it wasn't deliberate. It's just that one patient may take the whole day. And I mean it. One patient will keep you in the room for the whole day. Just back and forth, doctor moving, back and forth, back and forth. So when I hear this big, beautiful bill, who call it the big, beautiful bill? Did the government made it the big, beautiful bill, the name? Or it's just, I'm curious. If somebody know, please comment and let me know who came up with the title of the big, beautiful bill. And let me say this before I continue. If you like this channel, if you get information from this big, beautiful channel, just kidding. I had to put some humor in it. You know me, I had to do that. Give me a like, thumbs up, subscribe to this channel. It's information that will help you in nursing, that will safeguard you in nursing, that's navigating the world of nursing so that you know you keeping yourself safe and keep your license in the process. You want to get to this stage, 34 years of nursing. You want to go more than me. You want to continue and continue till you can't work anymore. This channel will keep you safe. Give me a thumbs up, like, subscribe. Leave a comment so YouTube will know I'm relevant. Sit back and think the shortage is only going to affect nursing home. It's going to force people who can't pay, who doesn't have insurance, families are responsible now. And if the family don't have any already struggling, it's going to be an uphill battle. The Medicare cuts that are at the bill in process, or it's already passed, 15 plus million people are set to lose their health care by 2026. Was just collaborating, discussing it with some nurses. The funds I thought about and I read about for Medicaid, because Medicaid kick in sometimes, like I was saying up north, when the person who's sick come in and they don't have insurance. They don't turn them away. I don't know the process in the South, but up north, Philadelphia, New York, the case manager try to find an insurance that the hospital would take, which I think Medicaid would kick in for them. The hospital now may see decrease in Medicaid funding. It's not going to be there. Nada. Gone. So what happened when people don't have insurance to go to the hospital? They already know they're going to turn them away. So it's another struggle. I don't want to use the word burden for the family. I don't know what to say. I really don't. And in Philadelphia, Pennsylvania, as a matter of fact, Delaware County hospitals, a lot of them close as we speak. And I think because they start seeing new corporation comes in and they buy them up and they close these hospitals. Funding is not there. The elite hospital, I call them elite, because those are the hospitals that has the university connect to them, and they get other funding, other big bucks to support their hospitals. Doesn't mean that if I don't have insurance, I'm going to be welcome there. And that's the bottom line. Profitable. They are more profitable than the hospital who rely on Medicare and Medicaid. The university hospital seems to be thriving. Private hospital, I would say. Because private hospital, first thing before you get in the door, and if you're an intake and you left one slip through the door, they get your head cut off. Because money first. And let me talk about money first and then your health. I can't say it any nicer. Because I've worked in those kind of facility. And you could see, I have a video that says profit versus nonprofit, working there as a nurse. What's the difference? Get them in, get them out, get them in, get them out. You know what I mean? I know you got to have humor to stay in this kind of situation. You have to have humor. When all things is just piling up and you don't know what to do, I laugh. It's not a nervous laugh. It's a real laugh because it eases my stress. I started listening to the Big Beautiful Bill. All I was concerned, to be honest, because I was so arrogant, I thought nursing wasn't going to be affected. Wow. How disappointed, how insulting to me. I made that big mistake. So like I said, I was only thinking about how is it going to affect homeowners, home insurance and what they cover and the state and the taxes. Because, every so often, I'm not even sure how they come up with these figures, but it's growing. And then I stumble on, all I heard is nursing home. And I work in nursing home sometimes. And I've worked in nursing home where I'm the only nurse for like 30 patients. It's now, in some nursing home in Philadelphia, it's now 16 and 16. Depends on how many beds they have. They may have 2 nurses, and that include the RN, and she will be the supervisor, the RN, giving meds, and an LPN on night shift. Day shift, they may have 2 LPN and 1 RN. They only need really 1 RN in the building. So this is going to be cut even further. They may just have 1 RN doing everything now and night shift. So be wary. Some people say, and I don't want to get into it, but I'm just going to put it out there. This bill, the fundings, the money that we're going towards more about getting these immigrants out of here. But I don't know what kind of immigrants they're getting out. Because now I'm hearing that if you're a citizen, naturalized citizen, you could go back home to wherever home is. And that's another video for another time. I asked this question to all my nurse co-workers. How is the bill going to affect us, older nurses? Some people say that it's really not going to affect the older nurses as much as the new nurses coming in. And I thought about that because I know I have been preaching to, when I see a good CNA, I preach to them, go to school to become a nurse. You are so good. Go to school. They lax. And sometimes I come off, maybe I care too much. If I'm telling you, you need to get in that school, now is the time. 2020 was the time. 2018, when I was, in staffing, it was the time. Everybody ignored me. But now, nursing student, I hate to tell you this, but this keep going. You might be able to break through, get into the CNA to bridge your way into nursing. The facility that you work, if you're in good standing, you don't call out, you don't walk out, you don't get no attitude, they may hire you as a nurse. LPN, if you're in the nursing home, stick it out. Don't leave because you're in nursing school. You're going to be an LPN. Stay in the facility and maybe they'll give you a job, because it's rough time now, because you're competing now with the older nurse who wants to stay in the field. A lot of us are finding it difficult. I went to a facility. This was a psych hospital, and I normally don't take charge nurse, even though I know I can do it. But I didn't, it wasn't nothing that I felt. It's something I feel. I was older, and they gave it to a younger nurse. Did I feel some kind of way? Yes, I felt some kind of way. I felt old. But I was still showing this person. And I'm not the type, some people, they don't want to show anybody anything, especially when when you show them, they're going to take away your position. And that's exactly what happened. They decided the young one should be the charge nurse. So I back away. I did help. I was supportive still, even though it was a hurt feelings. I had to put my big pants on and help. I'm not that selfish. In a way, in the end, I kind of enjoy not having it, because it was very stressful at times, dealing with difficult staff and administration on your back. And something I don't really like is stress. Stress is to the new nurses or nurses who are starting nursing school. You need to vote in the midterm. I don't think, I didn't know to see the day when I would tell people to vote. This is serious. This bill is going to affect everybody. I mean, everybody. Don't sit around, lay people who's not in healthcare, and think it's not going to affect you. It's going to affect you. So the midterm, put education, new nurses or nurses who are in the process, who are going to finish, because you're going to compete now with the experienced nurses. Education on the bill so that we can see where the thoughts of the big, beautiful White House come up with. I'm sure we didn't hear anything about student loans, so we all get it. You have to pay your student loan. As far as homeowners, I just think it's a ripple effect in everything, and just that we need to start saving. We need to start, before you save, take care of your home, take care so that at least you have some emergency funds. We talk about this sometime on this channel for insurance. And experienced nurses, some of us out there, and I'm telling the truth, do not have insurance. We don't have insurance. Travel nurses, the insurance is only for when you travel. After that, you can continue it, which is a high premium, or you can do it out and wait for the next one. When well, I'm still traveling. I haven't gotten any assignment yet, but I would say I'm still a travel nurse by heart. And when I get the insurance, I would do everything. I would do dentist in that state. I would get a physical, do everything there if you are one of those nurses that don't have insurance at this present time. Now, if you have a husband, that's something different. You can travel without any heartaches and problems because you have your husband insurance to rely on. I know many of nurses, they're in the divorce status and they still have insurance. That was one of their, I guess, divorce proceeding or whatever they call it. I'm sorry. um, so take a look at the bill, read some of it. It's a lot to read it and absorb it because some of the things I don't understand. So I would listen to YouTubers who has the knowledge or the time to read it and kind of put it in layman terms so that we could understand it. But I definitely see a problem that nurses always, everybody we vote for, we think they're going to do something for us. Is it selfish? Am I being selfish that nurses are never seen as anything? They always try to devalue us. They put everybody on this pedestal, the doctors, because they're going to get paid. They're going to get paid. We have to wait. We have to settle for less. Am I selfish for asking for more? Leave a comment. Let me know. And if you like this channel, subscribe. Have a wonderful day and night in your state and your country. I hope I have given you value.